I am so excited to have you on the show. Welcome, Dr. Jenn. Welcome to The Real Heal. I am your host, Dr. Renee Wallenstein, also known as the Libidoologist. So if you're ready, let's get into it.
Thank you. Thank you. I'm delighted to be here. I've been really looking forward to our conversation. I always love to be able to riff with people who had similar experiences to mine because there aren't that many of us. It's a scary thing to leave what we think about as traditional medicine, although it obviously is not traditional medicine. What the kind of medicine that is practiced today is not what traditional medicine truly is, which is the medicine of centuries and centuries ago. But it's a very scary thing to walk outside of that. And I know that you experienced that yourself, having been in that conventional medical field for 15 years and then walking out on your own. And I was actually having a phenomenal conversation with Terry Walls yesterday. Do you know Terry?
I know of her. I don't know her. Yeah.
So she was talking to me about, I was lamenting a little bit because in the oncology world, which is where I vibrate, I am still very much, despite the fact that I spent 20 years running a cancer program, now as an integrative oncologist, I'm suddenly a quack. Right. And Terry was just, telling me that it's a 30-year process.
Yeah.
And it took me 15 years to gain credibility. And that, I was shamed and tormented for 15 years by the MS Society, saying that I faked my diagnosis. And it was just really, it was inspiring. But you know that if you're going to strike a path, you have to be brave.
Yeah, absolutely.
And, we just know that we're going to come out on the right side of history.
Yeah, I agree. We're just paving the way, right?
Yeah. And just trusting the process.
Well, that is a great segue into my first question of like, who are you? Because you said, integrative oncologist, and you had
still asking myself that question.
Well, tell us a little bit about your journey.
I was pretty much born into a breast cancer family. So my first cousin was a woman named Linda Creed. And Linda was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was the queen of Motown sound in Philadelphia. She was beautiful, brilliant, like larger than life. She was my hero. I mean, people say like, oh, my cousin's a rock star. My cousin was literally a rock star. And her most famous song that she wrote was The Greatest Love of All. So she wrote that in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. And we got to go to the opening. And I mean, super exciting stuff, right? And then it really received its acclaim in March of 1986 when Whitney Houston released that song to the world. And you couldn't listen to the radio for an hour without hearing that 10 times on 10 different stations, right? It was the it song. And at that time, it spent 14 weeks at the top of the charts. Only Linda would never know that because she died of metastatic breast cancer 1 month after Whitney released the song. I was 16 years old and my hero died. And there was never a time in my life, I still don't remember a time in my life where I didn't know about breast cancer, didn't know about the devastation of breast cancer. I remember what Linda looked like when she lost her hair and when she got all puffy from the steroids with chemo. And I remember her being really sick at the end. And this leaves a really lasting impression on someone. And the only thing I wanted to do was never be in that position again and never have anyone that I know or love be in that position again. I just didn't want to be helpless with regard to breast cancer. I wanted to change. So I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. I was doing great and innovative things. Eventually, I was running the cancer program for my hospital. I was the chief of my department. And so here I am, really big job, lots of responsibility, sought after. And I'm a wife and a mother and a stepmother and an athlete and a philanthropist. And I have all these balls in the air. And like most accomplished women, we think we can do it all, and we can until we can't. And one day, everything came crashing down on me. And I went from someone who could play 3 hours of tennis without breaking a sweat to not being able to walk across the room. And I had this extensive workup. And after 3 days, I'm sitting in the office of my friend and colleague, but physician. And he tells me that I need to have surgery and chemoradiation. And if I don't do it right away, I'm going to die. And despite the fact that these were things that I recommended all day, every day to people without hesitation or reservation, when they were coming at me, it was like a foreign language. It just didn't make any sense. How could this be happening to me? And I still don't know why I refused treatment. I mean, remember, I'm running a cancer program at the time. Like, how could I refuse treatment?
Yeah.
But I did. And I did the thing that I tell everyone never to do. So I go to Dr. Google and I start to investigate, like, how do you heal naturally? And what comes up again and again and again is diet, 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 diet. Now, as a traditionally trained physician, we get little to no training. I mean, I had 15 hours of training around nutrition in my very first year of medical school, and then never again. And, realizing that 4 years of medical school, 5 years of residency, a year of fellowship, like, I have a lot of higher education. And basically, in all that time, I was taught about rickets and, scurvy. Ridiculous things that we just simply don't see anymore because our system is all about failure, right? It's not about optimization, it's about failure. So the nutritional training that we got was around people who were way off of the scales, and it just doesn't happen in this country. And the idea that food is medicine is completely lost in the conventional medical training field. So I decide, maybe there is something to this because, oftentimes when we operate in this arena of blindness because we think that everything that we're taught in medical school is true. And if we weren't taught it, it's neither important nor true. Yep. And I'm sure you had this yourself. Yep. Right? And it takes some major calling to be able to take those blinders off. So I enroll in the Institute for Integrative Nutrition because I'm trying to figure out, like, what can I do while I'm still, doing my job and I'm dipping my toe in. And so I enroll in IIN very reluctantly. I mean, I must have called them like 20 times and said, are you sure I'm going to learn something? Like, I'm a doctor. I'm a doctor for 20 years at this point. Are you sure I'm going to learn something? So they assured me, and I'm at one of the very first lectures, and a man named Mark Hyman walks on the stage. Now, this is like 2017. And even though he had a lot of acclaim at that time, I had no idea who he was. Wow. Like, that name meant nothing to me. So he walks on the stage, he introduces himself as a functional medicine physician. And I'm like, there's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick and that if I don't do something, I'm going to die. And so check my ego at the door, shut up, sit down and listen. And thank God I did. Because within 5 minutes of this man speaking, my whole world makes sense. And I know exactly why I got sick, so that I could be in that seat on that day, listening to this man speak, because this would not only be my salvation and the way to heal myself, but this is going to reframe and influence the way I would practice medicine for the rest of my life. And so I am an early adopter. So after listening to him, I enroll in the Institute for Functional Medicine, IFM. So at one time, I'm still a surgeon, still a mother, still a stepmother, not an athlete because I can barely breathe. And I'm full-time at IFM, full-time at IIN. And, it takes better part of 3 years for me to finish all of my training. But once I did, there was no going back. I mean, that's a bell that you can't unring. And, it was very much an uphill battle for me. My healing was not linear at all. In fact, I got much worse before I got better, because about a year after that, I woke up at 2:00 in the morning. It was an operating day for me. I woke up at 2:00 in the morning and the side of my face was numb. So I thought like Bell's palsy or a stroke or something like that. Tried to go back to bed, got up at 6 a.m. Now my right hand is numb. Numbness of the hand is not great for a surgeon, as you might imagine. And, over the subsequent weeks, I had other things, some like loss of vision in my eye. I was clumsy, dropping things, and I was on my way to an MS diagnosis. And it was right around that time that I'm in my training at IFM and I meet a woman named Terry Walls. And Terry, for people that don't know her, was an internal medicine physician who developed primary progressive multiple sclerosis. And her case was so severe that within 2 years, she went from functioning to having to be in a zero gravity wheelchair, which means that she could not even support her body weight to sit up. She lost her job because she couldn't perform the functions of her job anymore. And she had access to everything and everyone and every study and every drug, every infusion, everything. And despite that, she wasn't getting any better. And I don't remember what occurred to her to change this, but she adopted a whole food, grain-free paleo diet. And her book really details what she does, but it's like 3 cups of leafy greens and 3 cups of colorful and 3 cups of cruciferous. And she's very heavy plant-based, although she does include liver and certain nutrient-dense animal products. But she took out grains, took out legumes, and within like 4 weeks, she's functioning again. And she did other things. She did some electrostim. She did physical therapy, but she essentially reversed her MS with food, with diet, with lifestyle. And it was so awe-inspiring to me that I was like, bought her book and I was like, give it to me. Like, let me try it. Let me see what happens. And I had the same thing. Wow. I had the same thing. And, I don't think that these things happen by accident. I think our diagnoses are messages. They are so that we listen, so that we take stock, so that we are continuing to live in integrity and continuing to live our purpose. And while I was a surgeon, I really was not affecting the trajectory of people's lives. Yes, I was cutting out the cancer, but I was not changing why the cancer happened for those people. And there's really no opportunity within the confines of our conventional medical system to get people healthy. And I had one particular patient one day who came in. She was 19 years old. She was coming for a breast mass, and she gets wheeled into my office in a wheelchair because she has such progressed MS that she can't walk the 30 feet from the elevator to my office. 19 years old. Now, I was going through this myself. And I had just met Terry Walls. So I'm like a giddy school child telling her all about the Walls protocol and how she can reverse her disease. And I'm going on. And after about 2 minutes, she puts her hand up in my face and she says, "Are you going to do my biopsy or not?" And I was like, oh, yeah, not everyone wants to help themselves.
Mm-mm.
Some people just want the pill. Some people just want the knife. Some people just want the drug.
Mm-hmm.
Some people don't want to participate, and that's okay. But that's not what I want. I want to partner with people on their health.
Mm-hmm.
I resigned that day. My husband was not happy with me.
Wow.
But I went on to open Real Health MD, which is a functional medicine oasis for people dealing with a breast cancer diagnosis who want to restore themselves to health. And I have the opportunity and the ability now to really impact people's health, their future, their family, their community. It really, when you make a woman healthier, you don't only help them.
Mm.
The impact that you have is exponential. And I have the ability to reach millions of women in this arena. And that's what I intend to do.
I love
That was a really long story.
No, that was great. There was so many, like our stories are very much in alignment as far as like then, now, and like essentially, I keep saying, I find myself saying this a lot in the last week or so, like when you know better, you do better. And
It's so true.
I was still also in my OBGYN practice when I went to, I did my fellowship through the American Academy of Anti-Aging, so A4M.
Yeah.
And I was doing my training while still working and after an injury. So I was not operating anymore. I was just doing an office work, pap smears and such. And I remember seeing things that I started to think differently about, like, adrenal dysfunction, a woman coming in with all these symptoms that sound like adrenals. But of course, most of us would pop her on an antidepressant, right? And I'm like flipping over the paper and writing L-theanine, because I'm like, I can't, and that's when I realized, like, I'm like, I can't continue here much longer because what I know about hormones, what I know about other conditions outside of the conventional medical box that we've been trained are real. I had adrenal dysfunction. I had real issues. I was that one popped on an antidepressant. I was the one that thought about killing myself because I couldn't go on because the antidepressant wasn't helping me because I had other things going on. Yeah. And I feel like when your eyes are opened and a different way, I don't want to say better, but a different way of doing things that don't necessarily require your prescription pad, you tend to try that first, especially if it's not an emergency situation. Yeah. And I couldn't stay in that healthcare system where what I believed and thought was right by the patient was accepted. And again, I took an oath to do no harm, and sometimes writing for that primer. And I'm like, I am doing harm and I can't do this anymore because the insurance company won't cover estradiol, so like, just those little things I had to walk away also. And my husband also was like, what are you doing? Yeah. And I was like, sorry, I need to be able to sleep at night knowing that I'm not doing harm. I need to wake up in the morning, put my feet on the floor and know I'm living with purpose. And so,
well, don't feel that bad about the Premarin thing. I think, I think that you probably helped way more people than you hurt with that, because we really way overinterpreted the findings of the Women's Health Initiative. And they really mined for that data. And we can talk about all the places where the Women's Health Initiative went wrong, but I am an avid believer in hormone replacement.
Yeah, me too.
And that this is coming from someone who my life is breast cancer. I mean, literally everyone that I see either has breast cancer, had breast cancer, or is at risk for breast cancer.
Yeah.
So, and I think we did tremendous harm and a tremendous disservice by allowing those beliefs to, first of all, come out in the first place, that it should have never, ever, ever been published. And to allow it to go on for as long as it did. I mean, decades of women were harmed by this.
Yeah.
So I wouldn't spend another moment thinking that you hurt anyone with Premarin. I think
Well, I would,
really helped them.
I'm just not a lover of the synthetic hormones, which I am a lover of.
I totally get it.
Yeah. So, let's, this is really not a question I had, but let's go with this conversation of estrogen and breast cancer. Now, I just had another amazing guest before you who was very much a proponent of bioidentical hormones in breast cancer. And what's your take?
Yeah. So I think there are like 30 studies from 1980 till 2020, all found favorably in terms of hormone replacement for both in that it does not cause breast cancer. And even in women that had breast cancer, it does not lead to increase in recurrence. And for the women on breast hormone replacement, on bioidentical hormone replacement or any hormone replacement, even if they got breast cancer, they had better outcomes than people who didn't. So I think it's inarguable that hormone replacement is protective. Now, I think that we have to be mindful and select for who should be getting that. So if you have someone who has a clotting disorder or they're morbidly obese, or, these are people that we have to think about what the potential side effects could be, because you don't want to give someone a bigger problem than they have. But for a healthy woman, I think that the argument against giving hormone replacement is essentially not there. Like, I don't think there's any justification to even with a family history of breast cancer, I don't think there's any justification to denying those women hormone replacement.
So family history and a prophylactic mastectomy, no hormone. Oh, not oophorectomy.
Yeah.
Genetic history.
Yeah. So you're talking about a BRCA mutation carrier.
Yeah.
So, let's get into it. The
Yeah,
question is, does estrogen cause breast cancer? Right?
Yes.
That is the question. We know definitively that the answer is no. And let's just think about it from a logical sense. Would God really give us a hormone that causes breast cancer? It's absurd, right? It's an absurd concept. I can't even believe we talk about it
right now.
Now, if estrogen caused breast cancer, like, let's be the devil's advocate, why is breast cancer exponentially more common in the postmenopausal population that is deplete of estrogen? It makes no sense. The only explanation is that what estrogen is protective. However, we are living in a world which is very, very different than our mother's world and exponentially different than our grandmother's world. And the number of xenoestrogens, right? Chemical estrogens, synthetic estrogens that we come into contact with on a daily basis is astounding. This is a problem. Our toxins are a problem. And before I put anyone on hormone replacement, I'm cleaning up their environment. I'm looking at their hormone levels. I'm looking at their ability to detoxify hormones, because I don't want to add burden onto someone who already can't get rid of their hormones. I'm making sure their gut is working, because without gut excretion, you're not getting rid of hormone metabolites, right? The breakdown products of hormones. And it's not the initial hormone. It's not the active hormone. It's the breakdown products of the hormone that people get into trouble with. But, once you allow for that and balance it, there's absolutely no justification for not providing people hormone replacement. And I'm not just talking about for symptomatic relief of menopausal symptoms, which are no joke.
Yeah.
I mean, having gone through it myself, it's miserable. The brain fog is miserable. The mood changes are miserable. The lack of libido is miserable. It has a horrible impact on, like you're snapping at everyone. Your relationship with your husband is challenged. Your relationship with your kids is challenged. You're just like, you're not you.
Yeah.
Right. And I think so many people downplay that, maybe because it doesn't happen to everyone. And maybe because we think that like having a mood and having a libido and having patience and being able to recall names and words is unimportant.
Yeah.
But even if we toss that aside, what is the number one killer of women? It's cardiac disease, right? And we know that this protects against cardiac disease. It protects against peripheral vascular disease. So it also protects against stroke, protects against dementia, Alzheimer's. I mean, what do we all fear? We all fear getting Alzheimer's. And there is no other option that protects your bones, protects your heart, protects your brain. There's no other option. And the pharmaceutical companies would like you to believe that you can take you can take an antidepressant for hot flashes and, you can take medicines for bone loss, but these things not only do they not work, they also cause harm. And so I think the argument is like not even there. And I really hope, I know that you and I are ahead of the curve. And that is something, it's a bell that's hard to unring, but it's time to do it.
I have a large social media following, especially very vocal on TikTok. And the number of women, because I talk a lot about hormones and libido, and the number of women that I think the biggest comment was, I had a hysterectomy and my ovaries removed, or I'm menopausal, was some sort of history that their doctors won't, they can't take hormones and they're struggling. So there's that, and I think there is that should not exist. Right. And when we look at the real numbers, like let's take osteoporosis. Do you know that the number of women that die every year from complications of a fracture is the same number of women that die of breast cancer? Where are the ribbons about that? Right? The number of women that die of heart attack or cardiac disease is exponentially higher in every decade of a woman's life after 40. Why? Why are we not protecting people's hearts with the same enthusiasm that we're allegedly protecting their breasts? Well, it's funny you said that because two things. I had two comments. One of the comments was, when you were talking about the menopausal symptoms, when I was in practice, you had to be suffering from debilitating hot flashes for me to put you on an estrogen. Like you had to prove your case to me, like you're in court, right? Like I'm like, vaginal estrogen, that's a different story for vaginal symptoms, but like, even transdermal, like, no, like it's debilitating hot flashes only, these mood swings, this, that's all gonna pass,
nonsense. Right? It's in your head, or you can deal with it.
And I can say this because this was me. Like I felt for them, but I was like, but on the other side, my other point was I practiced defensive medicine. I was in a very litigious field whereby I was trained, be careful, document, don't do this, don't do that. That person, don't do it. You're going to get sued. You're going to get sued. You're going to get sued. And so like, I was constantly like looking over my shoulder, like, oh my gosh, like, does this person have a risk factor to, like documenting up a storm? And she, it's like, and to the point where I was, even with a patient wanting something, I would withhold it because I was like, I can't do that. And obviously that changed when I went into functional medicine, because then I was like, okay, we're taking care of the person. We're not taking care of the numbers. We're not taking care of like anything else. Let's take care of, like, we're not fearing, this is a different person I have here. She's a person that actually wants to get healthy in the ways that I know to get her healthy. So I think doctors are still kind of practicing in that paradigm of like estrogen only for debilitating hot flashes. That is it. not even the global
and the
menopausal.
least amount for the shortest period of time.
Correct.
Right.
Yep.
And
and 5 years, you're cut off. Like,
yeah.
I'm like, my doctor said I can only have 5 years. I'm like, really? Why? Like, why? And so, but on the other side, you were talking about the metabolites of estrogen, and yes, we don't have to get into all of that because it's a whole nother science talk, but a lot of women out there are not the healthiest. They are not detoxing. They're not pooping. Their livers are so congested. They're not, they're not able to, they're drinking too much alcohol. They're not metabolizing their estrogens. They're exposed to all of these xenoestrogens, right?
Yep.
So in that woman, is it still fine to put estrogen on top of her? Because I know in your practice, you detox, you like make sure everything's running so they can process them better. And
so this is why we need to educate our peers.
Yeah.
Because I don't know if you were asking any of these questions when you were practicing gynecology,
no.
But I don't think people are.
No, I wasn't.
I know for a fact when I was practicing surgery, I didn't even know these questions to ask.
No.
Right. And it's only through our training that we remember this, because though we were taught this in biochemistry, our first year of medical school, it's like conventional medicine teaches it and then kind of abandons the importance of it. Right. So we're never talking about it again. Whereas you and I, because we had this glorious opportunity to take those blinders off, to retrain, to relearn, to rethink.
Yep.
Now we're about helping someone to optimize their health. And we know that this is a person with multiple systems that are all operating in harmony and need to operate in harmony.
Yeah. Right.
So that kind of fractionated medicine that is being practiced today, it just doesn't work for this. So, that woman that's overweight, that's not detoxing, that, it's not appropriate to give her hormones. And I don't blame the conventional OBGYN for not writing them.
Yeah.
But I think it is high time for them to know this. Yeah. Like they should know this too. This is what medicine is.
Yeah. Yeah, I agree. And, and you and I, you were in clinical practice much sooner than I've been gone out of it for about 8 or 9 years now, but I have to say though, in defense of the docs, and you and I have been there, like I didn't have time in the office to talk about detox, diet, nutrition, sleep, toxins. Like I was just like, some days I had 10 minutes to see 2 patients, and like, in a 40-minute OBGYN initial visit to go through a family history and an exam, I didn't have time to talk about even healthy pregnancies, so like,
and quite frankly, you were dealing with the issue that they came to you for, and that was it.
Yeah.
Right.
Yeah.
And thinking about it in that segmented way. Right.
Well, and then, in the conventional system too, you get one complaint, like one thing I can talk to you about, and that's it. Like, you have any other complaints, you got to come back because I can't bill for it. So sorry, you're out of luck, Yeah. So like, I don't know where this has had, part of me thinks the work that you and I and all of our colleagues do online of like just spreading the word and talking about it. So it's a conversation that they could potentially have with their doctor. And a lot of them do get poo-pooed. A lot of them try to do things more naturally. And they're, I just had, again, social media, someone's like, they're trying to pour the pills on me, but I just want to heal naturally because it's not an emergency. I'm like, then the problem is you keep going back to your doctor with the same symptoms. All we know how to do in conventionally trained docs, and I was one, is whip out my prescription pad and give you a pill. Like, that's
prescribe
all we know how to do. And that's not to say anything bad about your doc, because that's how we're trained.
For sure.
And I didn't know better until I got out of that bubble, and like my whole world changed when I knew there was this whole side of, relearning the detox pathways and, and exposing myself to the fact that there are toxins. And I'm like, holy, crap, there's so much around us. And, just all these things. And like you said, I was the ovaries, fallopian tubes, uterus, cervix, vagina, vulva, and maybe the breasts a little bit. That was me. That's all anything else. I don't talk about liver. I don't talk about your gut. I don't talk about kidneys. Like,
but
that's
in addition, you probably didn't even realize how connected the gut was, how connected the liver was, right? Like it's not something that it was never taught to you that way. It was never presented to you that way. And so I say that, we think of physicians as critical thinkers, but they're really not. They may have been before they became physicians, but a celebrated physician, a great physician, is one that memorizes things really well and basically does the best job of what is currently being done. Because the second you're innovative, you're a quack.
Yeah. Yeah.
Right?
We follow algorithms.
Yes.
And protocols. And if you're outside of that, then something bad might happen, and that's how we're really conditioned to think. And you actually you say breast health is health. What do you mean by that?
Yeah. So people think that the breast is like some attachment, right? It's not part of you. And the truth is that people are so offended by this, and I'm sorry if you take this the wrong way, but the truth is that 95% of my patients come to me and they say, I'm healthy, but I have breast cancer. Right? So there's no such thing as being healthy if you have breast cancer.
Yeah. No.
Breast cancer is the indication that you are not healthy. And if you have precancerous changes in the breast, if you have cancer in the breast, if you had cancer in the breast and you didn't figure out your why, you are not healthy. I'm sorry. Just like there is no such thing as someone who is overweight and healthy, right? You may be functioning well, you may be compensating, but you won't do that for long, because being overweight is an indication that you're either over toxic, that your glucose metabolism is not working properly, your gut's not working properly, you're inflamed. I mean, we know all of this.
Yep.
So basically, inflammation is going to manifest itself somehow.
Yep.
It's going to manifest itself as autoimmune disease, as heart disease, as depression, anxiety, as osteoporosis, as arthritis, or it's going to manifest itself as cancer, right? And so these diagnoses, like I actually don't care that much about the names, because no matter what you're coming to me with, if you have a diagnosis, I know that there is an imbalance there. Yeah. I know that there is something there. I know that something is interfering with your health, because we are perfect beings. We were created perfectly. Our bodies, given what they need, they know how to heal. We are designed to heal. And most of the time, we just need to get out of our own way.
Yeah.
And so ultimately, at the end of the day, breast health is health. If you're healthy, you have healthy breasts.
I agree. We'll take on the topic of medical, standard medical care. Now, you say it's substandard and a treatment plan will never heal you. Only you can heal you. So I think, and that you need a health plan. So I think I'd like to take this in the context of your thoughts on conventional treatment of breast cancer.
Yeah. So for me, it's not an either or. For most people, it's an and. If you are at the point where you have a diagnosis, you have enough disease burden there to have gotten you a diagnosis. Now, do I think that everyone needs all the conventional modalities? Absolutely not. I think the vast majority of breast cancers in this country are overtreated, without question. We can look at, first of all, look at the DCIS population, ductal carcinoma in situ. It probably should not even be called breast cancer. It has no potential to spread, no potential to be life-threatening, and yet it is treated exactly like invasive breast cancer. Why? Why are we subjecting people to surgery, radiation, which can affect the health of the heart, the health of the lungs for the long term, anti-hormonal drugs, which will accelerate aging, accelerate heart disease, accelerate bone loss, accelerate brain disease? Why are we treating DCIS this way? So that is a whole category of women who are overtreated. And then there are the invasive cancers, which lack aggressive biology. And literally, no matter what you do, these people are going to be fine.
Mm.
They're not going to die of breast cancer, but we treat them all so aggressively. When you look at the statistics, and we can get a little bit into the mammographic screening program and why we're in this predicament. But when you look at the statistics, so the mammographic screening program, which was invented in the 1970s, rolled out in the 1970s, it was based on the understanding that breast cancer is predictable, that it starts at a certain size, grows to some critical size, at which point it is more likely to metastasize. And if you identify that cancer within that window, you will save lives. You will prevent breast cancers from progressing. And it's a great theory. It also happens to be false. Breast cancers are what they are from the beginning. So there are aggressive breast cancers and non-aggressive breast cancers, and size is not a predictor. So what happens is that, if you're using size as a predictor and you screen people more frequently, you are definitely going to find more cancers. But what you're not going to do is identify which is meaningful and which is not. So despite the fact that we screen more people and diagnose more cancers, the number of advanced mammograms that we see every year is constant, right? So people with aggressive disease are going to have aggressive disease no matter how aggressively we screen. And the number of women that die of breast cancer every year doesn't change. So if mammogram is really making an impact, why aren't we having less deaths? Now, they will report it in saving lives as a relative statistic. So we screened this many people, found this many cancers, and only had this many die. But the number that die is the same every year. So if mammogram is really saving lives, why doesn't that change? And it's because we're identifying all these cancers that don't really need to be treated. Now, those aggressive cancers, those mammograms that are presenting with advanced disease, the tumors that are identified as aggressive based on biology, these people I liken to their sink is overflowing, right? So you got to mop up the water. Chemotherapy, radiation, surgery, this is mopping up the water, right? These people are in crisis. But the far more important thing is, why is their sink overflowing? How do we turn off the faucet? How do we unclog the sink? And that's the work that I do with people. And there is no amount of surgery, there is no amount of chemotherapy, there is no amount of radiation that is going to cure anyone, right? Because unless you get to that root, unless you determine why someone got sick in the first place, what is stopping the recurrence? What is stopping the next manifestation, which by and large is cardiac disease? And I think it's no surprise that women who have been treated with breast cancer die at double the rate of the general population of heart disease. And it's because the reason that they got breast cancer was never addressed. And all of our treatment modalities, except for surgery, accelerate cardiac disease. So I'm just really not sure that we're doing anyone any favors in our current treatment paradigm. With mammograms, we're causing more breast cancers than lives we save. With our breast cancer treatment, the vast majority of people are overtreated for their disease and made more vulnerable to cardiac disease, which we know is the number one threat to life, more vulnerable to osteoporosis, and as many women die a year as a result of a fracture as do of breast cancer, and accelerate and increase the likelihood that you're going to get Alzheimer's. These are not insignificant things. And it's time that we took our blinders off and talked about this. We have to come up with a better way. We really do.
Is there any utility, and I know the answer to this, but of someone who has an aggressive type of cancer that chooses to do the conventional route, but she wants to do also holistic treatments? Is there any utility?
Absolutely. So that's an and.
Yeah.
And what I say is that, everyone who gets a breast cancer diagnosis gets a treatment plan. That's like a given, right? Everyone gets a treatment plan. But the one thing that everyone needs is a health plan.
Mm-hmm.
And that along with every different treatment modality, there are things that women can do. Most of them are free.
Mm-hmm.
There are things that women can do to increase the likelihood that you're going to respond favorably to treatment,
Mm-hmm.
decrease the side effects of treatment, both short-term and long-term,
Mm-hmm.
and prevent the next iteration of the inflammation or the driver of whatever is driving your disease. So to me, it's an and at the very least,
Mm-hmm.
right? Like this is something that everyone should be doing, because breast cancer, it's not a chemotherapy deficiency, it's not a radiation deficiency, and no amount of either of those modalities are going to heal you.
Mm-hmm.
Only you can heal you. And we know the avenue to healing. We know the avenue to healing is eating in a way that nourishes you and doesn't inflame you, moving your body in a way that's joyful. Sitting is the new smoking.
Yep.
Managing stress and having a big toolbox to do that, because the stress is never going anywhere. We are always going to be faced with stressors, but it's not the stress that matters. It's the meaning that you give to it. So if you develop a toolbox that can allow you to not internalize that stress and not allow it to impact your chemistry, that's essentially all you need. And then detoxifying your environment, making sure that your detoxification systems are working. And if they're not, figure out how to drive them. Prioritizing sleep. I mean, we are a society that values the waking world. And as a result, we've become sleep deprived. We have an insomnia epidemic, and we have a chronic disease epidemic, because sleep is where the healing happens. So if you're not sleeping, you're not healing. And you're not getting rid of all of those toxins that come in every day. You're not processing them, because the only time that that's happening is when all the other systems are resting. Right? And so prioritizing sleep, and lastly, living with purpose. You don't have to change the world. You just have to live in integrity in whatever purpose you were supposed to serve. And I know that that is a hard thing for people, but I also know that when you arrive at what you were supposed to do, you know it.
And here we are.
And here we are, right? Here we are.
Yeah.
And, had you told me at 30 that I was going to change my career entirely, retrain and change my career entirely at 50, I would have told you that you were batshit crazy. And yet here I am. Right?
Yeah.
5 years later, and changed my career.
Yeah. And never looking back. Don't regret it. Right.
And never looking back.
Yeah.
I mean, so grateful. I'm sure you felt this, like so grateful for the opportunity to have been a surgeon.
Yeah, me too.
There is nothing like that bond with the person that literally puts their life in your hands. They are the most vulnerable you could ever be, helpless under your hands. And it was such a privilege. I mean, I'm just so grateful to God to have given me that skill and that opportunity. And on the flip side, I did that for 20 years. I feel really good about the contribution that I made in that space. And I'm on to the next thing, which I know is far more impactful and far more meaningful.
I agree. I love that. Yeah. And all the naysayers, like I heard so many times, like, oh, well, that's so sad. Like all that education down the drain. I'm like, nope. Why is it down the drain? I take my medical education every day with me. Like the knowledge I have, I
Yeah,
just tweaked it and I learned more, So it's just so funny that people just think when you pivot careers in medicine, all of a sudden it's like, oh, you left that behind. Now you're doing. I'm like, no, I took it with me.
yeah,
I took with me the things that really serve me and that I still need. And then I left the knowledge of everything else. I still have it, and a lot of stories. I have a lot of stories, but
hmm
can we just
well,
end the clinical part of this talking about cancer screening? Because I know we were talking about this before I hit record that, I'm following somebody's journey who found that she had metastatic stage 4 colon cancer on a screening test. Obviously, it was a screening test that she had to go and search for where the cancer was, but like, I didn't even know this test was out there, so you can educate me and others quickly because I
absolutely.
know we're
So
almost running out of time.
so typically when we talk about breast cancer screening, we're traditionally talking about mammogram, maybe MRI in some instances
Yep.
of extremely dense breasts, or you have implants, or you have a BRCA mutation, or if you've had a history of breast cancer. Those people are screened with MRI. I have a big problem with both screening mammogram and screening MRI. I think that screening mammogram is barbaric. It's
Mhm.
painful. It in the over a woman's lifetime, it's going to cause more cancers than lives it saves. And it's really time to abandon that. I am so excited to be a part of a company which has come up with a painless, radiation-free, uh, affordable breast screening modality. So you'll hear more about
Mm.
that from me in the upcoming months. And it will replace both mammogram and MRI. So that's really, really amazing. But when we're talking about general cancer screening, I mean, we're still talking about pap smears. We're still talking about um,
Colonoscopies.
colonoscopy,
Mhm.
right?
Yep.
And there is virtual colonoscopy, but again, that's a radiation load. Um, so, our screenings are not, our screening modalities are not great. And then there are so many cancers where there really isn't a screen. There's no great screen for ovarian cancer. There's no great screen for uterine cancer. Cervical cancer, I mean, yeah, a pap smear, but again, not the ideal way
Mhm.
to screen people. So there have been a number of companies that have come up with circulating tumor cell tests.
Mm.
Companies like Signatera, like Cell Search, like the RGCC,
Mhm.
and certain ones are better at identifying circulating tumor cells and knowing what cell line they come from,
Mm.
like the Signatera is especially good at that. There are certain ones that are great at, once you have identified the tumor, they're great at therapeutics. So the RGCC is actionable in that it based on tumor genetics, it knows what modalities are most effective. Like, is this going to be a radiation sensitive tumor? Which chemotherapeutic modalities would be optimal for this? Which natural products can be used to form a treatment plan? And they can also be used for follow-up. There's also a new like whole body fast MRI. I forget the name of the company. And I think this test is under $500. I
Wow.
don't know if it's being covered yet by insurance. I wish I remembered the name of the company.
Are
Um,
any of these covered by insurance, do you know? Or are
some
they
of
out of
them
pocket?
are.
Uh,
Some of them are. Um,
but you need a history of a cancer, family history of
most
cancer?
most people are not using them for traditional screening.
Okay.
And it's because just because you have circulating tumor cells doesn't mean that you have enough of a tumor volume to identify the primary.
Gotcha.
And so, but what I like about this is that if you know that you have circulating tumor cell burden, you can use this, even if you don't have a mass to remove, you can use this as an impetus for change. Because unfortunately, despite the fact that I have been doing this for 25 years, the person that comes to me to say, Jenn, I just want to be the healthiest version of me I can be. I want to do everything I can to prevent breast cancer, are few and far between. Like I can count on one hand, right? Most people don't change until they have some major reason to change, like a diagnosis.
Look at us.
Yeah, exactly.
we were in that same boat. So,
and I get it.
Yeah,
I get it. Right.
Yeah.
Change is super hard. And you have to have for most people, you have to have a really, really good reason to do it. And we also do not know what being healthy means. Right. Like I thought because I wasn't overweight, I was healthy. I was wrong. Right. And we know that even people who aren't overweight, only 14% of Americans are metabolically healthy, which means that there are a large percentage of normal weight people who are not healthy. So they may not be overweight, but they are over fat. And we should talk about the importance of having a proper diet and doing the proper exercise as time goes by, because as you cross over 40, the need for weight-bearing exercise to replace cardiovascular exercise is significant, right? And that's what ends up maintaining our bone mass, our muscle mass, and our metabolic health. And so I forget where I was going with this, but
yeah, the screening tests. I mean, I think they're out there. They're not perfected yet, as from what I hear. They're like they're in their infancy.
Yeah, they are. And mostly because we don't know what to do with a lot of the results.
Yeah.
Right. And a lot of them are going to put people on somewhat of a wild goose chase. But if we can, and I believe that this is coming, I believe that this is on the horizon. If we can get it to a place where we know that you're at risk, here's what you need to do to mitigate that risk. And I believe that that's where we're going, because as you and I know, we are about health optimization. And if you are in optimal health with optimal function, disease doesn't happen.
Yeah, I love that. So just briefly, because we're coming to our time, but you have a lot of things coming down the pike. You have a podcast, you have a book, you have a summit. Like, can you what's the name of your podcast that's launching? What, October? No, when's your podcast coming out?
Next month.
Oh, next month. Okay.
It's Keeping Abreast with Dr. Jenn.
Okay. So that will be probably when this podcast airs. It'll be.
Yeah. So
another podcast you can listen to.
Stay tuned for that. Another podcast you can listen to.
And then the summit.
And I am very much going to stay in my lane and talk about breast health. But as we stated here today, breast health is health. So there are a lot of things that go into that.
Yeah.
And I would love for you to join me and tell your story on my podcast.
Absolutely.
This summit will be in March of 2024. Okay. And this is going to be the first breast cancer summit hosted by Dr. Talks. And so I'm really, the speakers that I have on this summit are amazing. I've already locked down 30 rock stars in the area of cancer. So I'm super excited about that. And I'm partnering with Dr. Veronique Dussolier.
I know her.
Who is the breast cancer conqueror, right?
Yep.
So we're partnering on this. So it's really going to be an amazing summit that anyone who is affected by breast cancer in any way should 100% plan to attend.
Dr. V's been on this show, so
she's amazing.
Yeah, she is amazing.
She's amazing. I love her.
Yeah,
and she was actually a huge inspiration for me when I was making that transition. And then my book is called My Answer to Breast Cancer, and I hope that will be released just before the summit in 2024.
Awesome! Wow.
Yeah. Yeah.
And then I know you have something, you have a gift for the listeners, your recipe book. Is that?
Oh yeah. So we,
Give us a link
my
to that.
my team and I came up with all of our best plant-based recipes. It's called Recipes for Real Health. It's a functional medicine guide to eating deliciously, and we have a couple hundred recipes in there. Really
Wow.
amazing stuff, and evidence that plant-based eating can be amazing. I think so many people are reluctant to adopt a plant-based lifestyle because they think it's going to be less than, and that their food is not going to be delicious and they're going to feel deprived. And it's just simply not the case. And we really put together a plan that is amazing and delicious and nourishing. And I'm sure people are going to enjoy it.
So I think you gave us a link for that. So we'll make sure that's in the show notes. And last question, a personal question. What is one thing that you know now that you wish you knew 5 or 10 years ago?
Yeah. So without question, I wish I knew how much power we actually have. We are so raised to believe that power is outside of us, and that we have to surrender our power to other people. And it's simply not true. It's simply not true. We actually are the key to health. We have everything that we need inside of us. And it's just embracing that, trusting it, and listening to what your body is telling you. And I wish I had that intuition, but the flip side of it is that I have it now, and it's my mission to convince the world that they have the power to.
I love that. I love that. I think the listeners, they hear this a lot of like intuition, listening to your body, and, don't be like me and wait till you're, deep down and like have to get out of a ditch,
Crawl
out
out.
of a ditch, try to be proactive. And that's
Yeah.
what we practice. We try to, well, you're still trying to help those that have a diagnosis, but I think moving forward, you want them to be more proactive with their health. And
I do. The vast majority of my patients, even the ones with metastatic disease, the intention is for them not only to recover from their cancer, but to have the best health of their life. Because again, most people don't know what it means to be healthy. They don't know how to be healthy. And once they learn those skills, they enjoy health after their diagnosis that they never even knew was possible. So many of us are walking around in a state where we think that we've normalized so many things. We think it's normal to be tired. We think it's normal to be achy. We think it's normal to be stiff. We think it's normal to have difficulty with sleep. We think it's all of these things that we've normalized because conventional medicine doesn't know how to help you with them.
Yeah.
Right. And so we exist in a sick care system with a sick care mindset. And it's getting out of that mindset, getting out of that system and really working towards health that you realize that like health is not only possible, it's probable if you engage in these practices.
I love that. So good. Now, of course, my listeners already love you. They're like big fans of Dr. Jenn here. So where can they find you? Where do you like to hang out the most?
Yeah, so I'm on Instagram at Dr. Jenn Simmons, and my Jen has 2 N's. I'm also YouTube, same thing, Facebook, same thing. And you can visit my website, Real Health MD. I do have a public Facebook group called Keeping Abreast with Dr. Jenn. It's the same name as the podcast. And anyone who wants to follow along, ask questions, and just be an active part of this community can join.
I love that. Well, thank you. Thank you for taking time out of your busy schedule, all the things you have coming up, and joining us today, because you were amazing. And thank you for shedding lights on these topics that not a lot of people talk about. So I appreciate it.
Thank you. Thank you so much for having me. It was a pleasure.
Well, I hope you enjoyed this episode of The Real Heal and that you learned something new. And with that, I'm out of here. Talk to you again soon.